Hey everyone, Dr. Rowe coming to you from SpineCare in St. Joseph, Michigan. In this video, we're going to go over exercises that can give both quick and long-lasting relief for one-sided sacroiliac joint pain. If you're unfamiliar with the sacroiliac joint, commonly known as the SI joint, it is the union of the sacrum and the ilium of the pelvis, and it acts as a shock absorber for the spine above. When this joint becomes inflamed, it can cause a lot of issues, including pains across the lower back that works across the buttocks, even into the hip or the back of the thigh. So what usually causes this is a blend of weakness and tightness in the muscles that help support this joint, including the glutes, hamstrings, and the hip flexors. To make getting relief easy, I broke the video up into two separate parts. In the first part, we're going to focus on getting quick relief by lengthening and stretching those tight muscles. In the second part, we're going to switch gears and focus on getting long-lasting SI joint pain relief by strengthening. Both parts work differently, but they are meant to work together. So to get the best results, go through all the exercises and use what gives you the most relief. With that being said, let's get started. Here's a quick relief stretch that we can do seated. This first movement is going to target the hamstring muscle group on the back of our thigh. So whatever side that you're having SI joint pain, let's say it's your right side, let's straighten that leg out as much as we can and just press our heel downward into the floor until we feel a really good activation of the muscles on the back of the thigh that works towards our hip. From here, we're going to have very good upright posture. Just have your back as straight as possible. Now take your hands, put them on your hips, and what you want to do is slowly rock your hips forward as much as you can. To make it a little bit easier, imagine your tailbone right here, scooping it backward like this and pressing it downward into the seat of your chair. As you do this, you're going to feel a deep stretch form on the back of your thigh. You should feel it pretty much from the back of your knee all the way up towards your butt cheek. You're going to hold this comfortably for 20 to 30 seconds and then release it. On the next repetition, try to build into it a little bit more and repeat this 3 to 5 times. And even if the other side doesn't hurt, I do recommend throwing a couple repetitions in on that side just to help keep everything nice and loose. But since we're already in a seated position, let's take this one to the next level and do another exercise that's now going to help target the glutes. This is called the seated pigeon pose or figure 4. So again, whatever side that you're having SI joint pain, let's say it's your right side, let's take that side's ankle and place over our other side's knee. So when you look down, it should look like a figure 4. What we want to do with this bent knee is slowly press it downward towards the floor, but don't use your hands. Instead, only use your leg and hip strength. The more that you press it down, the more that you're going to feel a deep activation form around the hips, but more importantly, you should feel it into the sacroiliac joint. Focus on feeling it into that SI joint. Just keep pressing down until you do. You're going to hold this for 5 seconds, release it, and then repeat this 5 to 10 times. And with each repetition, just try to build into it a little bit more. If you would like to deepen this stretch, what you can do is take this bent knee, press it down, hold it, and now keeping your back straight, just pivot forward, lowering your chest towards the floor. Do this one slowly because that stretch will get very intense very quickly. But go through both of those movements. You're probably going to find that one just offers a little bit more relief. And at that point, I would keep building into it over and over again until everything is nice and loose or you're not getting any more improvement. Just remember, whatever you do on one side, always do on the other side to help keep everything in balance. So here's a quick relief stretch that we can do standing. This is called the step back, and if this is the first time doing it or if you have a lot of balance issues, I do recommend doing this next to a wall or at least having something that you can grab onto that's sturdy for support. So the first thing that we're going to do is get in a wide scissored stance like this with the painful side towards the back. So I'm going to demonstrate what to do if you have left-sided sacroiliac joint pain, and try to get in as wide of a stance as possible. You should really feel a good stretch forming over the front of this back leg, targeting the hip flexor muscles. So once we've done that, what we're going to do with our front foot is turn it inward as much as we can, trying to feel a really good stretch form on the outside of this hip. And then we're going to do the same thing on this back leg, focusing again on feeling that stretch around the hip. Once we've done that, we're now going to step back, leaning backward, placing all of our body weight onto this back foot. Do this one slowly because you're going to feel a deep activation of the muscles, including the glutes around the hip, working into that SI joint. Once you feel that, let's hold this and now really take it to the next level by putting our arms and hands out in front of us, kind of like a genie position, and now slowly turn and rotate through your waist towards that painful side. This will really deepen that stretch. So only go for a deep, comfortable stretch and then hold this for 20 to 30 seconds. Release it. On the next repetition, try to build into it a little bit more and repeat this 3 to 5 times. Afterwards, you're going to want to switch legs and focus on the other side, even if it doesn't hurt, just to help keep everything in balance. So here's a quick relief stretch that we can do in bed. Just lie flat on your back like this. Whatever side that you're having sacroiliac joint pain, let's say it's your right side, you're going to have that knee bent at 90 degrees, knee pointed straight up towards the ceiling. The first thing that you're going to do is turn your foot inward as much as you can, and then you're going to hold this. Now take the hand on the other side and you're going to place it right on the inside of that bent knee. And what you want to do is try to drive this knee across your body towards the other side shoulder, but you're going to resist against it with your hand. Let your hand win this battle. When you do this, you're going to feel a deep activation of the muscles around the SI joint, including the glutes. I like to hold this comfortably for about 5 seconds, release it, and then repeat this about 10 times. And with each repetition, just build into it a little bit more. But to take this one to the next level, we can focus on activating the muscles a little bit differently, hopefully get some more relief. So this time around, I'm going to turn my foot outward as much as I can, and then I'm going to take the hand on the painful side and place it on the outside of that bent knee. Again, what we want to do is let our hand battle our knee and let it win, but we're going to try to sweep our knee outward like this, going straight away from our body. Again, as you do this, you're going to feel a really good activation of those muscles around the SI joint, so really focus on feeling that. Hold this for about 5 seconds, release it, and then repeat this 10 to 15 times. But go through both of these movements. You're probably going to find that one just helps out a little bit more. At that point, keep throwing repetitions in until everything is nice and loose, or you're not getting any more improvement. So let's switch gears now, focus on getting long-lasting sacroiliac joint pain relief by doing strengthening exercises. This first one is called a wall slide. What we're going to do is go next to a smooth wall and just place your whole backside flush against it. You want the painful side facing towards the ceiling, and support your head with your hand just like this. This bottom leg, I'm going to bend my knee and just press my foot into the wall, offers a little bit more support. The key is though, keep this top leg straight, the painful side, and just gently press your heel into the wall until you feel light activation of the muscles around the hip, around the pelvis, around the SI joint. Once we've done that, we're just going to slowly raise our heel and foot upward towards the ceiling, kind of creating an arc like this. The further that you go up, the more that you're going to feel a deep activation of the muscles around the sacroiliac joint. Just go up as far as you feel comfortable. Hold this for a couple seconds and then slowly come back down. But fight your leg weight going down. It's going to target the muscles a little bit differently. So you want to more or less go up slowly, fight your leg weight, and also fight it going back down. Try to do this about 5 times in both directions. And afterwards, see how you feel. If it feels like you have a little bit more energy, challenge yourself by throwing in another set or 2. But if you would like to make this one a little bit more challenging, target some more muscles, hopefully get some more relief, this is what you can do. As you take this foot upward, what you want to do is slowly turn it outward like this as much as you can, activating those muscles across the hip. And then when you come back down, turn your foot inward as much as you can, again fighting your leg weight. Definitely makes it more challenging. So try to give that a try when you are ready. But if you really want to take this one to the next level, scoot away from the wall. That way you won't have the support of it, and as you do this, it's going to be a lot more challenging. Just remember though, whatever you do on one side, always switch and repeat on the other side to help keep everything in balance. So another really good way to strengthen the main muscles that support the sacroiliac joint is by doing an exercise I call the bird dog hydrant. For this one, we're going to start on all fours on a floor, but for demonstrative purposes, I'm going to do it on this table. So what we're going to do is start with the painful side. So let's say you have a lot of right-sided SI joint pain. You're going to take the foot on that side and slowly slide it away from you as much as you can until you feel a really good stretch forming in your calf muscles that works upward towards the back of your thigh, over the hamstrings, and then finally over the SI joint. Once you feel it over the SI joint, you're going to hold this position and then slowly raise your leg upwards so it's roughly in line with your body. you're going to feel a ton of muscles start to fire across the lower back, into the pelvis, and then finally into your hip. Let's hold this comfortably for about 3 to 5 seconds, and then what we're going to do is lower our leg back downward like this, have our knee bend at 90 degrees, let it hover a little bit above the floor, and then you're going to swing your knee upward towards the ceiling, also rotating your body to look upward at the same time. Focus on moving through your hip with this one because you're going to feel a ton activate across the SI joint. Once you feel that, hold this comfortably for 3 to 5 seconds and then finally relax, take a breather. On the next repetition, you're going to do this on the other side because we want to keep everything in balance. But I will try to do this about 5 repetitions on both sides. With each repetition, try to build into it a little bit more. Afterwards, see how you feel. If it feels like you have a little bit more energy, challenge yourself by throwing in another set or 2. If the exercises help, please support the channel by giving this video a like and maybe subscribing too. If you have any comments or questions, please leave them below. I'll get back to you as soon as I can. Thanks for watching.